The symposium today is something that we do every other year, and we take advantage of the month of October when the breast cancer is highlighted in the news. And we bring together women and experts in the community to talk about women's health, what new developments there are in the care of breast cancer, and what we can do to prepare ourselves and also to help us avoid the pitfalls in lifestyles that can lead us down the road of a cancer diagnosis. The speaker that we're having, we're very excited to have Kelley Tuthill, who is known to a lot of us through working for Channel 5, and she was brave enough to share her journey through the diagnosis of breast cancer. So we reached out to her and asked her if she would join our community tonight and share her story.
Well, I'm really looking forward to speaking here for Beth Israel Deaconess Plymouth. For me, it's all about spreading hope and letting folks know that a breast cancer diagnosis is not a death sentence, that there are really good treatments today and a lot of reasons to be hopeful. I was diagnosed with breast cancer at the age of 36. I had two small children at the time, 2.5 and 6 months old. I went through a lot of treatment, about a year of chemotherapy, a mastectomy, and radiation. But I can fortunately say that was 12 years ago. I'm a proud survivor and doing really well, very healthy. And I even had a third baby 9 years after my breast cancer diagnosis, and she's doing great.
Having a symposium like this benefits the community, which is our mission at the hospital, to make sure that we're not only caring for the folks that are walking through our doors, we're presenting a wellness opportunity for our community.
The one thing that I've learned through my own experience with breast cancer is that patients need to be informed and that the care needs to be centered around the patient. So knowledge is power. So the more power we can give women through information, through meeting the docs, hearing from patients, that means if God forbid they get a diagnosis, they're not going to be scared, they're going to know the right questions to ask and feel very empowered that they can navigate the system. Since my diagnosis in 2006, I've really tried to make it my life's mission to speak to other women, both publicly and privately, to offer them my experience, to make the road a little easier for the next patient diagnosed. I speak publicly about my story because I want people to have hope and to know you can get through treatment, that there are many reasons to be hopeful about long-term survival. And I think when we come together as a community, it's just so powerful because I'm just one of many people that will be in this room that have survived breast cancer, and that's good for everyone to see. One of the things that interests me the most and that I'd like to share with the crowd is to talk about resiliency. And in my 20 years as a news reporter, I saw so many people unexpectedly face very serious loss and tragedy. And the thing that kept me going, the thing that kept them going, was to tap into their resiliency. And I saw people take their darkest moments and lead into something incredible, a positive thing that they were able to contribute as a result of their tragedy. And so that's kind of my message to people, that you may be blindsided like I was with something you did not expect, but as Robin Roberts from ABC News likes to say, how can you make your mess your message? And that's what I've been trying to do for over a decade.